Welcome, everybody. I'm so glad to see faces. This is wonderful. And I'm so glad that there are live streaming faces, too, that I can't see. I just am happy to see responses here. So welcome to the OSU Humanities Initiative Speaker Series event today. The program that you're here to attend, in case you're wondering if you came in the right room, is Bat Soup and Signs of the Beast, COVID Legends and Conspiracy Theories with Dr. Andrea Kita. Who I'll introduce in just a second. I do just want to get through some information about our programming and our centers, and hopefully you'll be able to join us in the future for some things we have too. So I am Sarah Milligan. I'm the interim co-program facilitator for the OSU Humanities Initiative this year, while Dr. Jennifer Borland is on sabbatical, although she's probably joining us on the virtual end of things today. So I'm also the department head of the Oklahoma Oral History Research Program, which is here in the OSU Library. It's a department of the library. Our office is just catty corner over there, so in case you really like the oral history or the sort of documentation of people's stories, parts of processing things, if that's what we do, we're here to talk to you about it at any time. Today's event is sponsored, as I mentioned, by the Humanities Initiative, and we are super excited to say that we're now transitioning into a new phase and a new name, which will be the OSU Center for the Humanities. So as this new center develops, our mission will continue to focus on increasing the visibility of humanities on campus and fostering new and collaborative research. We're really, really excited about this. So I wanted to thank especially to Dean Kreutz and the College of Arts and Science for his support in this achievement and moving this towards from initiative to a full center. And we're excited about what the OSU Center for Humanities will be able to accomplish. To find out more about this, you can go to our website at humanities.okstate.edu. If you want to know more about our events and our programming, and you want to be on our email list, you can email humanities@okstate.edu. I know you will be surprised. And we will add you to the list of upcoming events and things that we have going on. We do have a few extra events this semester that's going to be coming up, two specifically that will be virtual, and that's part of the part 2 and 3 of a series that we're doing with new tenure track faculty here at OSU in the humanities and arts areas. Those will be noon to 1, Wednesday, March 9th, and Thursday, March 24th. So you can register for those to get the Zoom links on our website. I have really enjoyed those, getting to know research from some of our new faculty in those areas. The other thing that I am really excited to be able to announce today is that we're now taking applications for a brand new research group fellowship, which will begin next year. So this is something that we've been working on and talking about. If you've been to other programming this year, you've heard us talking about planning for it, and we're ready to launch the applications now. So this program incentivizes a shift from individual or siloed research structures to a cross-disciplinary team model. So we're really trying to bring people together that have shared research focus and trying to encourage doing really collaborative projects. So you can find out more about applying to be part of one of these research groups, a fellow in one of these research groups, on our website. The due date for those applications is April 4th, and we're going to have an informational session on Tuesday, March 22nd. So thanks so much for the library for hosting us today. Thanks to ITLE for live streaming, and the library for helping to manage that as well. Also, I would like to say that the Oklahoma Oral History Research Program is also a co-sponsor of this event. Now to our speaker, and while you all are really here. So, Andrea Kita is a folklorist, which I'm excited about because I'm also a folklorist, and I don't always get to say that as proudly and loudly, and is a professor at East Carolina University, where she studies vaccination, belief, and contemporary legends, as well as the supernatural. She's the author of Vaccinations and Public Concern in History, Legend, Rumor, and Risk Perception, which won the Brian McConnell Book Award in 2012, and her monograph, Kiss of Death, Contagion, Contamination, and Folklore, won the Chicago Folklore Prize and Brian McConnell Book Award in 2020. That was a good year to have that book out, even though I know it was unintentional. She's also interested in internet folklore, narrative, and contemporary and urban legend. I won't over-explain that on why it's One of the two labels. And as the co-editor of the Journal of Contemporary Legend, which, if you're interested, is a scholarly journal that's published annually by the International Society for Contemporary Legend Research. So at this point, I will pass this over to Dr. Kita. We'll have questions and time at the end for more conversation. So thank you so much, and help me welcome our guest.
Okay. All right. Try not to drop that. I'll just hold it, it's fine. Hi everyone, it's nice to see people in person. This is kind of exciting. So thank you so much for coming out today. I really appreciate it. And thanks so much for bringing me here to this campus. This is my first time in Oklahoma, so I'm pretty excited. So yeah, today we are talking about bat soup and signs of the beast. COVID legends and conspiracy theories. And it is fun to be somebody that talks about conspiracy theories because everybody wants to talk to you. So that's kind of the nice part. The kind of bad part is sometimes it's really depressing to talk about conspiracy theories. So I will try to temper this as much as I can with both interesting ideas, but also, oh wow, we're in a bad place right now. So I am fine with you tweeting if you prefer to do that, if that's the way that you like to collect information or put information out there, I'm okay with it. You can tag me in it. I already regularly get death threats, so it's totally fine. Yeah, God, yeah, every vaccine, anybody that does vaccine research gets death threats. It's just kind of part of, they don't really tell you that when you start, but it's kind of what happens. So yeah, feel free. And I also wanted to say I am at East Carolina University, which is confusingly in North Carolina, just in case you were wondering. So people are always like, where's East Carolina? It's in North Carolina. So let's get started. So as we've all obviously figured out, COVID-19 is much more than just a pandemic. So it's pretty much changed everything about the way we interact, how we live our lives, everything we do. So I don't think I really need to explain that to you. You probably much have all been living it, so you know this. So we're going to be really talking about this and dealing with this for a really long period of time. Not just because this pandemic is, of course, still ongoing, but because, of course, one of the many uncheerful things I get to say today, because we have to prepare for the next pandemic. So sorry, but that is, of course, a possibility. So we have to think about how this is going to affect what we're going to do in the future. Does it affect things like mask wearing, how we educate people, working at home, all of those kind of things. So there's so many questions that this entire scenario has put into our lives. And this is really important to think about because it really changes everything about the way we think and we experience the world. So that really just shifts our entire worldview and it changes all of our belief systems. And that's really, really crucial for understanding a lot of what I'm going to talk about today because so many things have changed. So because of all these changes, we need the humanities more than ever, but especially folklorists, of course, because I'm a folklorist. But I think this is actually really true. And I always think about this because way back when I first started researching vaccination and why people weren't vaccinating, especially with childhood vaccines, I went to an interdisciplinary conference and I remember a vaccinologist actually came up to me and was like, I'm so glad you're here. This is so great. And I was like, okay, thanks. I was a little shocked. And he was like, I can make the best vaccine in the world, but I can't make anybody take it. That's your job. And I was like, oh, thanks for the pressure. That's great. But he was right. He could make these amazing vaccines, and he was working on vaccines that would be used for very, very young children. And that was a huge concern, is what if I make this amazing vaccine and nobody uses it? And that's where the humanities and the arts really step in. We're the people that can talk to people and get them to actually use these things. I'm going to lift this just a bit because I realize it's kind of low and it's making weird noises sometimes. But why folklorists in particular? For a lot of reasons. Some of the big ones is that we're experts on how traditions change and how people can create new tradition. And we've been doing a lot of that throughout the pandemic. We've been figuring out how do we still celebrate things? How do we attend parties? How do we, I remember one of the first things people came up, they're like, how do I go to a party and have a drink if I have a mask on? And I'm like, oh, we're going to have a whole conversation about this. But there's so many things we've had to change about how we interact with people and how we celebrate our lives, and also how we celebrate the lives of people who have passed. How many of you have been to a Zoom funeral? they're weird. I have been to some. So it is one of those things that, that people are participating in, because we have to figure out how to continue our lives, how to continue to do the things we do in the context of our traditions, but also make them safe. So how do we negotiate that? And folklorists are great. They're in a perfect position to talk to people about that. We also really focus on the experiences of individuals and their folk groups. So the group of people they belong to, who they understand, how they process information. So if you want to get people to make changes, you have to understand their group, and you have to understand their individual behavior. And if you don't understand that, you're probably not going to be very successful when it comes to making changes. So you have to really come to people where they are instead of expecting them to change to what you want them to. You can't always, like some people are going to do, they're like, okay, I'll put on my mask, it's not a big deal. But not everybody feels that way, right? So there's ways that we can talk to people and get them to understand what we want them to understand and negotiate. So find that line where everybody can be as safe as possible, but also still participate in the things they want to do. So we also understand networks, which is why I've actually encouraged a lot of my underemployed folklorist friends to go out and be contact tracers. We're really good at understanding networks and how people interact and how they know each other. We also understand the importance of the arts. So a lot of folklorists actually work directly with arts organizations. And that actually becomes really important because some of our best campaigns, especially in public health, are via the arts. And there are different ways that we can use the arts to really promote healthcare, health promotion, and just generally getting people to do things that we hope that they will do for themselves as well as for other people. And of course, we also understand the role of propaganda, conspiracy theory, rumor, and legend, which is pretty much what I'm going to be talking about today as that last little bit. But to just give you some of an idea of what other folklorists are doing right now. So let's start with a couple of definitions just to get those out of the way. So I'm going to start with defining propaganda as the intentional spread of disinformation or withholding pertinent information for a specific purpose, okay? That's how I'm defining propaganda. So this is intentional misinformation, or disinformation, I should say, so I'm going to define those later. And even that with like holding back information as well is considered like a part of propaganda, and especially if it's for a specific purpose. And then let's talk about conspiracy theory a little bit. So I actually like the word conspiracy thinking more because it is a spectrum that we all engage in. So we all actually believe in some conspiracy theories. They're just like low-level conspiracy theories, like that they add weight to the scale at the gym, or that the parking police are after you specifically, right? That's the kind of stuff, like, yeah, we all kind of like every once in a while we're like, they're after me. Like, so we all do it, like on some low level, right? It's just, you know, to what extent? But I think we have this really specific idea in mind when we hear the term conspiracy theory, and that's these people. So that's what we think. We think crazy people with tinfoil hats and making charts and, you know, little lines of red string. That's what we have in mind, but it's actually something we all do. It's just we don't always necessarily take it to that point. And I'm actually starting to kind of play with the idea that it is the actual creation. It isn't taking those red strings and drawing it across. It actually is what makes a conspiracy theory conspiracy theory. It's the actual like act of putting it together. So I'm still working on that though as a definition, but I like this conspiracy thinking idea, especially because we all engage in it. So the main point in this is this idea that there's some sort of entity or government agency or something behind it all, right? Someone is pulling those strings. And one of the things that I sort of love and hate about conspiracy theories is they wrap everything up in this perfect little neat package in a way that never happens in real life. Everything makes sense in a conspiracy theory. When you like start to pull at the strings of these conspiracy theories, people are like, oh no, but this also explains these other 5 things. And I'm like, oh my God, that's beautiful. Like, how does that work? It's so amazing. Like it's actually as a narrative work, it's amazing and beautiful and very carefully crafted. But that's not how life works, right? We don't get closure. We don't get those neat little packages. I have never been a part of any large organization that was, you know, able to do something like control the temperature in the building, much less, you know, run entire governments. So I'm pretty sure there's probably not somebody behind it all, because it's not that simple. But that's part of the beauty of a conspiracy theory, is it is that simple in a conspiracy theory. It all comes together perfectly. Clearly, these people have never been to a meeting, or at least none of the meetings I've ever attended in my life. So I always kind of wonder about that. But it's a really interesting narrative format because of the way that it brings it all together. So then let's talk about misinformation and disinformation. So misinformation is when somebody uses logic, but they get it wrong. And they're not intending to do anything harmful. So this is like when people post stuff on social media and they think it's like good information, but it turns out not to be good information. And we see that all the time. We've probably all done it ourselves. Where you're like, oh, that sounds like something that could be true. And you put it up there and then you're like, oh, it's not true. Whoops. There's no intent there. You're not trying to harm anybody. It's just you're working with what you think is correct information. Disinformation is totally different. It's actually purposefully planted incorrect information, and it's meant to cause harm, right? So this is two totally different things. But it's always based on previously established folklore, and that's kind of the cool part. The disinformation that works the best is the most effective, and I mean effective in really terrible terms in that it gets people to believe information that is untrue and possibly harmful, is there because it already plays on folklore and what people already know. So even things like when you get like bots out there like spamming information, it's still based in folklore. They're still basing it off this stuff. And they're successful. The most successful ones are based off of already established forms of folklore. So it's still in there. The other thing I want to point out too in this point is not all folklore is incorrect. I think a lot of times when people hear the term folklore, they think automatically it's like false information, but it's not always all false. Sometimes folklore is true. Folklore is really like to define folklore more as informal knowledge. So all the stuff you know that you don't know how you learned it in the first place, that's more of how we define folklore. So it's not always necessarily the stuff that's false. So it's not all incorrect if you're talking about folklore, but when we're talking about misinformation, disinformation, it's incorrect. Okay. So I stole this directly from sociology. I'm just going to say that right out front because it looked good and I liked it. I was like, way to go, sociology. I like your stuff. So they came up with this idea of this types of information disorder. And they put it in terms of falseness and intent to harm. And they put in this third category. So we have the misinformation, we have the disinformation, and then we have something called malinformation, which is something that's real but then is misattributed in some sort of way. And I kind of like this term because folklorists have been talking about this stuff for a long time, but we didn't have a term, I don't think, as much. We call it conspiracy theory, we call it contemporary legend, but we didn't have something that really got at its intent to harm. So I think that's really interesting. And we certainly talked about how it does harm people, but not with the same sort of structure. So I kind of like this structure as a way. So I stole it from sociology. But I think it's a great way of thinking about that overlap and how that intent to harm versus falseness kind of works. So let's talk finally about rumor and legend. So you've heard me use the term contemporary legend several times. Folklorists like that term better because not all of them take place in urban areas. But urban legend is usually the common term, so you'll hear me switch back and forth, but contemporary legend is what we like to call it in academia. So I'm giving you one definition of a contemporary legend, which is the unsubstantiated narratives with traditional themes and modern motifs that circulate in multiple versions and are told as true or at least possible. So I really like this idea of them being true or at least possible. And I put down there, they may or may not be believed, but they're believable. So they always have that element where it could be true. Like maybe it's true. Or that puts that little kind of like, oh, maybe that could be true. Like that sounds like a thing that could be true. So it sounds enough like the truth that it seems like something that's believable. The other part I like about this is narratively how it works. And sometimes it works, it doesn't always work this way. But one of the ways that it works is that if you want to feel somebody out to see if they maybe think the same thing, you can tell them this in the guise of, I'm telling you a legend, I'm telling you just a story I heard. And then if they react poorly, you can be like, oh yeah, no, I thought it was really funny, it's a story I just heard, yeah, I don't believe that. But if they react positively to you or react to the story, you can be like, yeah, I know, right? Can we talk about this now? So it gives you that sort of area to play with it, and it keeps you safe So no one's going to think you're dumb or an idiot if you bring up something and you'll be like, oh, it's just a story I heard, haha, I thought you guys would think it was funny. So it kind of gives you that space too to talk about these things. And that's how a lot of people do talk about them, is I heard this story. And then that kind of sets up that whole format. Another thing that I find really interesting about contemporary legend is they always have this structure of it being able to be tracked down. And folklorists like to call this a friend of a friend, or a foef. So it's always your uncle's girlfriend that this happened to, or who told you this. And then if you would go to that person, you'd probably find another foef, right? But it gives it this sort of believability again. It adds that credibility to this. It came from this police department. If you look at that police department's website, it is not there. In fact, they might have something saying like, please don't believe this stuff that says it's from our police department, because it's not. These are all ways of making it look more credible, right? And adding to that believability. And then with a rumor, it's sort of a more brief version of this. So rumors tend to be not to have this sort of complex narrative structure in the way that contemporary legend does. So they're kind of about this. So they kind of go back and forth. So sometimes you'll hear things like, vaccines cause autism as a rumor. There's a more complicated narrative behind that, but a lot of times all people know is vaccines cause autism as a rumor, which is completely untrue, by the way, just in case you were wondering. So, but that is a pretty common one. So, where you are and which stories you hear very much depend on where you live, right? So we're talking about something like COVID virus origin, which just came back up in the news again, in case you missed it. There are a lot of people out there that's like, no, it definitely is the Wuhan wet market, and I will talk a little bit more about that in a second. But in the US, you might hear that China created the virus as a bioweapon against the US. In China, you might hear the virus was brought to China via the US military base in order to infect the Chinese people, in order to ruin their economy or lower their population. There was one rumor that was going around, very specific. It was 2 men and 1 woman. It was so specific that I was like, oh, there it is. There's that specificity that I love to hear about that just makes me go, oh, this can't be true. But I don't know why. Why 2 men? I just kept thinking, like, why 2 women and why 2 men and 1 woman? Like, I don't. But they were all military. They're US military, and they were on the base in China, and they're the ones that started it, in certain places in China. If you were in Hong Kong, you might have heard that the Chinese made the virus in order to ruin the US economy, but then it escaped somehow. So depending on where you are depends on what the legend looks like, how it's going to interact, how people are going to perceive it as being true or not true. So I wanted to give you some examples of this. Weirdly enough, I picked these out several months ago, and they're from the Ukraine. That was not planned, but these were some that were put out by a group in the Ukraine. And some of them probably look very familiar to you, right? Coronavirus is a bioweapon. It's just the flu, and there's no need for extra measures. Then we get down to coronavirus is the EU's revenge for Brexit. I had not heard that one, but apparently that was one in Ukraine that was going around. So this gives you kind of that different versions of it. So some of these sound just like ones we've heard. So some of them do end up being pretty popular in a lot of different places, but then other ones are really just very specific to certain areas. They also did a part 2. And I love, everybody's all about the 5G. I love that we were all just very convinced that 5G was just gonna like murder us all. It has been really interesting. And this is one of the things I've noticed a lot with conspiracy theory and actually with legend as well, is every time technology changes, the stories change just a little bit too. So every time it's just that little twist. You get a little bit different version of it. You get an old story that's retold, including the new tech. Which is absolutely true. If for most of you who grew up hearing that your cell phones were going to give you cancer, I would like to introduce you to the world of if you sit too close to the television, it will give you cancer, which was predated by if you sit too close to the radio, it will give you cancer. So sitting too close to any technology has always given us cancer, supposedly. Also probably not true. So this really interesting to see these little changes in different places. So these things sound familiar, but there's just slightly different versions of it. So yeah, it's kind of fascinating to really think about. So some of them overlap what you'll see in the US, but some of them will be new to you. So everybody gets different versions of this, but there are certain things that really kind of just remain the same. And those tend to be categories that are almost always there, at least when it comes to diseases, are the origins, cures and prevention, and blame. Because we gotta know where it came from, how do we fix it, and who do we blame for it? And that's apparently what we care the most about, because that's what you see over and over again. So let's start talking about some of those. So when we're talking about COVID, obviously our origin and the location that we were the most concerned with in the US was China, and specifically Wuhan, because that was where our first sort of versions of it that we heard that it might be originally from Wuhan. As I mentioned, this was just in the news again lately, a couple days ago actually, where they're like, no, it's definitely the Wuhan wet market. It's definitely that, it's not a lab leak, because that's been the big debate. Is it a lab leak? I was like, the second I heard lab leak, I'm like, guys, come on. But it sounds like something that could happen, right? It does. It sounds like something that happen. So maybe it has. But probably it's from the wet market, we're pretty sure. And I should just say too, at this point, we have disease because we live in close contact with animals. That's just facts. That's just how we get disease. So that's unfortunately just how it happens. But one of the things we get really obsessed about, especially in legends, is weird things people do and what they eat. And we always like to other people by especially talking about the food that they eat or the way that they eat that food. So that was a big one. And one of the big things, of course, is the wet market. Wuhan wet market, which I have actually weirdly been to long before the pandemic. It is a perishable foods market, which is basically a glorified farmer's market. That's it. But wet market sounds gross and disgusting, right? We hear wet market, we're like, ew, gross. You don't want a wet market. It sounds like that should be a place that's dry. Like it just doesn't sound right to us, right? But that's all it means. It's just a farmer's market. They sell perishable foods. It is a big farmer's market, but it would be as big as going to a place like Seattle or any other major large city that would have a large farmer's market. It wouldn't be that dissimilar. And especially bat soup became the big thing. And this was often the picture that accompanied it. And this picture makes me laugh so hard, just because I love how the little bat is just like garnish. Like, what? Why? Like, I don't understand this picture or why it started to spread, but this is the picture. If you Google bat soup, you will see this picture. This is the picture everyone puts up. I don't know about you, like I'm not a great cook, but if I was gonna cook a bat, I think I'd put it like in the soup and not like on the side, hanging just out like parsley. It's very bizarre. Also, I think I would choose a larger bat than this. I'd go for like a flying fox level bat, not like the world's tiniest bat ever. Yeah, that doesn't make sense. But that was the big thing. Oh my God, they eat bats, how gross and disgusting. And that's so much of what we see when we try to other people, especially when we're doing this through a xenophobic lens. Let's start picking on the things they eat. And this comes from a long-standing tradition of being very xenophobic about what people from generally other countries, but specifically China. We think of especially people in China as being, let's say, adventurous eaters is the best way to put it. I've also found while I was in China that people are like, do you want to eat this? And I'm like, oh, okay. And I'd eat it and they're like, we don't eat that. I'd be like, thanks guys. Like, you could have given me a heads up. That is how I ate donkey in China. Apparently, they're like, do you want to eat this? And I'm like, okay, yeah, sure, I'll try it. And they're like, I can't believe you just ate that. And I'm like, why'd you let me? It tasted fine. It didn't really taste like, it just tasted like meat, to be perfectly honest. It was not that exciting. But anyway, it is one of those things where we have this idea that other people eat weird food and the things that we eat are somehow not weird. But of course, if you ask other people, the things we eat are totally weird. And you can think about the things you grew up eating. And some of them are definitely weird to other people. But you grew up eating them, so they're not weird to you. So when we think about this stuff and how we've kind of done this through this xenophobic lens, we also have this idea too that there could be another purpose or reason behind this. So we have the idea it could be accidental, but it's accidental in a gross way that would never happen to us. I don't know about you guys. I do not know much about the flora and fauna of Oklahoma. I have bats in my backyard in North Carolina. Actually, I have a bat house because I'm trying to get them to eat all the mosquitoes. But this could easily happen in other places. It is not that this is specifically, strange in any sort of way. It's our close relationship with animals that can cause these things to happen. But if you're going to go for it happened, there's an origin and it is intentional. People are out to get us. The election became a big one. The 2016 election became a very big focal point of this, that it was an entirely made-up event to sway the election in one way or the other. It was also there to wipe out people or economies. So, you know, if you wanted to believe it started in the US origin, we were doing it to wipe out other people. We were doing it to wipe out elderly populations because they were costing us too much money. There's sort of a litany of different versions of this. It was done to make vaccines mandatory, because once you make one vaccine mandatory, it's all downhill from there. Not necessarily, but that was sort of the supposed idea. The idea too was out there to microchip everybody, because there's microchips in the vaccine. That's another rumor you've probably heard. We will talk about that in a little bit too. That was another one, and it was also just there as profit, purely to make money. If you wanted to make money, I would say do it via a pill that you have to take every day. That's going to make you a lot more money than a vaccine that you take once every 6 months or so. That's just me, maybe. I don't know. I think there's better ways to make money than creating a pandemic and then creating a vaccine. Although rich people did make a lot of money during the pandemic, so I can't say that's not totally untrue. If we look at things like cure and prevention, one of the big things in the cure and prevention is that there's something that we can do. There's something I can do as an individual, or there's something in my house that will solve this problem. So we got a lot of folk remedies early on. One of my favorites was the different types of breathing you could do. If any of you guys remember this early on in the pandemic, okay, some of you remember this. Everybody was sharing it was like, take 3 short breaths, then exhale a lot, then take a big, deep in-breath. And I was like, you know, cool. I think everybody needs to take a deep breath right now. That's probably a good idea. But this is probably not going to cure your COVID. But it was this idea out there that there was something we could do to prevent it. There was something that would make it stop. I heard the same thing about garlic. So eating garlic, putting garlic in hot boiling water and inhaling the steam, all kinds of things with garlic. I don't know why garlic, but garlic is always there. I don't know, maybe it was the bat thing. Maybe they all are related. I'm gonna make a conspiracy theory right now, right in front of you. I'm calling it, vampires are behind everything. They sent out the bats. Garlic will stop it all. That's how it's working. But yeah, then there was other things like common household items. Bleach became a big idea for a lot of different reasons. Light became another one, using UV lights. That kind of stuff, yeah, it was everywhere. Different herbs and vitamins. So vitamin D, vitamin B, zinc, ginseng, tree oil, and traditional Chinese medicine also came up a lot. I had a lot of people telling me, they're like, if you want to get rid of COVID, it's Chinese disease, you need Chinese medicine. And I was like, okay. That's a new take on it, but all right. So that was something that a lot of different people were saying. Prescription drugs, of course, being used in different ways. Not necessarily because there was nothing, of course, at the time for COVID, but using different prescription drugs and people actually seeking these out in spite of how well or not very well they worked. So that became a big thing. Of course, we had a whole big thing with dewormer, too, for a while. There's a whole idea, too, that there's a cure, but they don't want you to know about it. They're keeping it from you. And then it was all going to end after the election. That was one of my favorites, too. It was like the second the election was over, COVID gone. The second it gets warm out, COVID gone. There was all these ideas that something was going to happen that was going to change everything about it, and it was going to happen very rapidly. Then, of course, you have the anti-cure legends, which is the X doesn't really work, masks don't really work, it's all a hoax, it's just a bad flu, all of that kind of stuff. And then, of course, you have prevention. So this, if you guys, some of you may have done this, wiping down your groceries and boxes and everything that entered your house. I remember a lot of people were doing this and just bleaching everything on the face of the earth, and they were like wiping in stuff even when it came in your house, your delivery packages, all that kind of stuff. And it got to the point where people started referring to this as cleaning theater or hygiene theater, because some of it, while it is always a good idea to wash your hands and generally be safe, some of it was more performative, especially in large spaces, just to get people to come back. So they were doing the type of cleaning that looked good and was very visible, but might not have actually done anything actually for prevention of COVID at all. Then, of course, you get into the vaccine rumors and legends, which I've been studying since 2002. So yeah, like 20 years now. And I started off with childhood vaccinations and the and flu vaccines, and now, of course, I'm on to COVID. So the big one, of course, is that the mRNA vaccines are too new and too untested. Of course, the vaccines have been around for a very long time. This is just our first opportunity. And I really don't feel like people understand what a big deal the mRNA vaccines are. This is gonna be like, people are gonna look back at this like they look back at like when we like discovered penicillin. Like, that's how big of a deal it's going to be someday. We just don't see it because we're in the middle of it right now. But someday we're going to look back and realize like how amazing this was and how incredible it was and what a big innovation this was and how it was a game changer. But right now we're not there yet. There's also, of course, the idea that COVID vaccine doesn't work, especially when it came through breakthrough infections. That really kind of reinforced that, even though breakthrough infections happen and they are not as severe as other ones and they keep you out of the hospital. Putting heavy metals into the vaccine and the whole making you magnetic trend. Some of you may have seen the TikToks of that. Yeah. These people clearly never like rubbed a spoon and stuck it on their nose in their life. As a kid, I was just sort of, they're like, look, it's sticking to me. There's a lot of TikTok videos. If you've not seen these, you should definitely look them up. They're pretty amazing. It's just people like putting spoons on themselves and be like, look, it sticks. It's like, I have so many, yeah. It's like, it's not how science works. But there was this idea that this was going to make you magnetic, that the vaccine would make you magnetic. Also, the microchips in the vaccine, and this is where we get into the sign of the beast stuff. Guys, everything has been the sign of the beast. Barcodes, microchips, the little chips in your, on your, sorry, I'm totally blanking right now, credit cards, your credit card chips. Literally every piece of technology has been the sign of the beast. Your cell phones, everybody has like put all of these things, it's like, yep, it's all coming true. This is the sign of the beast. So every time any kind of new technology comes out, especially a new technology that either goes on us or with us or near us, it is going to be the sign of the beast. And that's it. Revelations is happening, end of the world, it's all going down. And that is another one that, like I said, as technology has changed, this one has changed along with it. Mind control chip in the vaccine, that's another good favorite of mine. You're going to get your vaccine. It's not only going to have a microchip in it, but it's going to be a microchip that Bill Gates can just turn on and make you do whatever he wants. God, I wish this technology was like available. It'd be pretty cool. I mean, I actually don't wish it was available, but at the same time, that'd be pretty cool. All again, going back to that created only for profit, the notion that it violates freedom. And there's so many other ones. I could legit just stand up here and talk about this for the next year, because I've been studying it for 20 years. You don't want that, and you just don't want that. So let's talk about our last category, which is blame. And this is where I find like some of our biggest problems come from. In particular, that we blame people instead of institutions. Which is really where a lot of our blame should be, because people are going to act like people. That's just simply what we're going to do. And you can talk to us, but if you don't put us in a situation where we can make better choices, we are not able to make those better choices. So if you put a bunch of people in a situation where they have to work or they will not be able to afford their food and their places to stay, and then get mad at them because they go to work, yeah, that's not gonna work. So we, of course, blame China and to an extent, Asian people. So Asian crime, Asian crime as in crime against Asians went up significantly after the pandemic first started. So there were a lot of people who were experiencing hate crimes. Simply put, I unfortunately saw some of these happening. It was very disturbing, but they were blaming all Asians too. Anybody that looked vaguely Asian as somehow responsible for starting a pandemic. It was very unclear why we were mad, but we were mad. College students was another big one. Like I mentioned, I am at East Carolina University. You may have heard of us. We had a 400-person party the second that they let us back at school. The weekend before it started, we made national news. Yay. We always make national news for the best reasons, and it's things like 400 people parties during a pandemic. Yeah, and I got really mad about it because I was like, well, you're the ones that brought them back, and then when they acted like students, you got mad at them. That doesn't make sense to me. They were just doing what they would normally do. If you put a large number of people in a place, they're gonna wanna hang out. It turns out we're social, so we like to do this stuff. Then there's also this blame on asymptomatic carriers. And I've actually written quite a bit about asymptomatic carriers in the past. And the fact that the asymptomatic carrier is one of the scariest things to us because they look like us, but they are infected and we don't know. They are other, and we are unaware of it because they look like us, they're our friends, they look just like the person that we knew the day before, but now they are like a secret harbinger of disease. And we didn't know. They have become transformed, but in a way we cannot tell. We like symptomatic carriers. We want people sneezing and coughing because then we can stay away from them. We're like, oh, no. You stay away. An asymptomatic carrier is extra scary to us. And we had a lot of those during this pandemic, which made us very suspicious of loved ones, of anybody in general. I just got on a plane. It's terrifying. I was just like, I don't know you people. I don't know where you've been. I don't know what you've done. But it does. It makes you very cautious because you don't know what other people have done. You know what you've done, but you don't know what they've done. And then, of course, we have the things like super spreader events, too. And there's been a sort of history of those. A lot of weddings, funerals even, all kinds of events that turned out to be super spreader events. So having one of these events and then finding out afterwards that it turned into a super spreader event. This is not something you can know going into it. You can only assume that you were attending a super spreader event, right? There's no way to know beforehand if somebody if it's going to turn into a super spreader event or not. But then you put, a bunch of college students in a town and like, stay home and don't talk to anybody. It's not gonna work. So you have super spreader events. And then, of course, we also have the New World Order, the Illuminati, and all those other people that are going to cause these things to happen. And again, going back to that technology, we have the 5G again, bioweapons, vaccines and microchips. All of this stuff is to blame. If we just didn't create all this new tech, this new amazing tech that makes my phone go really, really fast, and I love it, we would be perfectly fine. So there's all these different places to put blame. And the reason why we like to put blame is because blame means that there's a way for us to avoid it, right? If we see, oh, they went to a wedding and they all got COVID, I'm just not gonna go to a wedding, right? So it makes us feel safe. And that's why we like to do this. We like to find the patient zero. We like to find the origin. We like to find the super spreader event because it makes us feel safe. If I don't do X, Y won't happen to me. So every time we hear about these, we like store it in our memory and we're like, okay, so that's the thing I won't do. So that kind of helps protect us, but it also gives us somebody to blame, right? And we like to blame people for whatever reason. It is just part of our makeup, I guess. So there's lots of other ones as well, but these are the big ones, and I didn't want to get into all the details on all of them because I find it incredibly interesting, but not everybody does. So, but I wanted to really talk about why this is so important. And it's because these are more than just stories. They're actually really deeply embedded cultural information. They tell us a lot about ourselves. They tell us a lot about other people. They tell us a lot about what we're afraid of and all the things that we're thinking. So they really help us articulate those concerns too. So sometimes even when we don't have the concern fully formed, we can start to figure it out as we start to tell these stories or as we start to share things on social media. We start to put together what about this is bothering us. They're also believable, of course, as I discussed earlier, and that kind of adds doubt, though, because of that believability. We can kind of add that element of doubt. Oh, okay, wait, what if this is different? What if there's something going on here? The other thing is everyone does this. It's not any just one group of people or a race or profession or political affiliation or socioeconomic group. This is one thing that drives me nuts is people always be like, again, with blaming other people, they're like, oh, those people over there, they believe in that stuff more than us. I'm like, no, you all believe in it. It's just to what extent. Where are you on that conspiracy thinking spectrum? So we all do it. And it gets transmitted really fast, much faster than it ever has in the past. Thank you, internet, and thank you, social media. Both a wonderful thing, but also it's a tool, and what we do with it is problematic. So we have to be really careful about how we use this tool. And of course, it contributes to stigma. So as I mentioned, we saw a rise in hate crime against Asians and Asian Americans. It's contributing to the stigma of different people, even college students, because now everybody thinks it's all your fault that we have COVID. So that kind of stuff, it really just causes all of this different kinds of stigma. And even just stigma too about travel, stigma about who you've been with, all of those kind of things. So it's all of that Again, xenophobic sometimes. Don't hang out with people that aren't of our group, because that'll cause problems. And of course, this takes place in medical information, and it affects your medical decision making. You make your decisions whether or not to get a vaccine based off of this stuff, right? So that's why it's important, because you're deciding important medical things about your own medical care based off of something you saw on social media. That's a little scary sometimes to think about. And that's why we need to always get our information from as many sources as we possibly can, and reliable sources too. So, in short, it's up to folklorists to save the world. So, I have got lots of plans. Everybody listen up, I got tons of plans. I have like a million plans. I say I have a plan, I've got like 50 plans. So let me just give you some examples. So my ideal world, let's hire some folklorists. We're gonna be contact tracers. Awesome, we'll do great at that. Also, documenting culture and seeing those shifts in tradition in what I think would make a really great new version of the Works Progress Administration, the WPA, which worked out really well in 20s and 30s. Also, they did some really great things with building infrastructure, so we could do that too. That would be a great thing. Let's pay some people to do this stuff, and get people some good jobs, and let's raise the minimum wage, and yay, everybody wins. We can also interview people who have COVID survivors, not only for their narratives, but also to make a master list of symptoms and long-term side effects. Long COVID is a major issue right now, and we are still figuring out what is long COVID. We don't entirely know. We don't know exactly the mechanisms. We think it's related to inflammation in some sort of way. People have very different things. Why do certain people get it and other people don't? There's a whole bunch of stuff. And this is a way that folklorists in the past have come together to come up with different syndromes. At one point, nobody knew that menopause was a real thing. There was a time, believe it or not. And to this day, actually, a lot of the evidence shows that doctors actually, their experience and how much they believe their patients about their menopause is based off of their mother's experience with menopause and what they saw their mothers go through, more so than actual scientific fact. That's mind-blowing to me. Blows my mind. But for a long time, it was the women going through menopause who were the ones that created the original list of the symptoms of menopause. It was not the doctors, it was the patients. It was the people helping those patients. And we see that right now too. There are all kinds of online groups for like, long COVID survivors, and people who've had COVID and had weird reactions to different things, or people who've had weird reactions to vaccines. There are all these people out there doing this work, but they're just regular people. And we can help them with that. And if we put all that information together, maybe we can come up with some solutions. Yeah, it'd be really cool. I think it would be a great idea for us to do that and to learn more about this. We can understand all of people's fears about the virus and the concerns, and then we can actually turn that into localized public health materials. We can make it into art projects, make it into different things that will actually help convince people that they should be doing certain activities or not doing certain activities, or changing the way they think about different things. In different ways. And there's so many different ways we can do that. And we can do that in a way that also would fund artists, would help people out in a variety of different ways, and help us modify some of those traditions, and help us be able to still have the kinds of lives we want to have, but to do it safely. And then, of course, we can also train community partners and healthcare workers in ethnographic technique, which is part of what folklorists use, is an ethnographic technique, so they can understand how to talk to people and how to assuage their fears. I spend a lot of time talking to public health professionals and to doctors and nurses about how to talk to people about vaccines. And always the gut reaction that I find so many people want to do is just list all the reasons why they're wrong. That is the worst way to talk to somebody about a vaccine, is to make a giant list of, here's all the things that you're afraid of and why they're wrong. That's not going to go over well. Nobody wants to hear a list of why they're wrong. You actually have to listen to people. The other thing too is if you start listing all the things that why they're wrong, and there's something on the list they hadn't thought about, congratulations, you've just given them a new fear. Like, maybe ask them what they're afraid of. Crazy idea, but it does work really well. So there's so many different ways that we can use what we know as folklorists, what we know as oral historians and people in humanities, and really make this a better way of doing this kind of information, and teach people how to do that kind of stuff. And do it via community partners too, because that's a great way to get into communities. And also work with communities to establish trust and intermediaries between healthcare workers and public health and the communities they serve. So we can be the in-between people, right? We don't have to be the public health people. We don't have to be the doctors and nurses. We can be the in-between people, and we can do that work when other people are too exhausted to do that work. Right now, healthcare is in a complete total crisis, both in mental health and physical health right now. People are exhausted, they're tired, they're quitting. I have lost 3 family doctors this pandemic. Yeah, all of them just gone. They have quit medicine entirely. 3 doctors, that's kind of crazy. So if we take that pressure off of them, they can do their job as of treating people, and then we can do the job of informing and educating and talking. That would actually help them out a lot, maybe alleviate some of that stress too. So take that stress off that system as well. And of course, obviously save the world. So I wanted to give you guys a lot of time to ask questions, which is now is the time, but I also wanted to show you this is the stuff I've written. If you would like it, I will send it to you. You do not need to buy it or get it at your library. Like, that's fine. My book, The Kiss of Death, is actually still free from my publisher. As soon as the pandemic happened, they put it out there for free. I asked them just to do a chapter. They're like, we'll do you better. We'll put the whole thing online. So it's out there online. You can download it from my publisher for free. But the other ones, if you can't find them or get them, I will send them to you. You can get, just at me at Twitter and I will send it to you. But please, any questions you have, please, this is a great time to ask. Yeah, please go ahead.
So you mentioned that there is both a construction and a ramification of rumor and urban legend.
Mm-hmm.
How do you, or I guess a better question is, like, what resources do you recommend for how that happens in construction? Like stereotypes leading into things that become urban legend, conspiracy theories, that build up things a lot more.
Okay. I'm going to try to reframe that because they asked me to do the questions. I want to make sure I got it right. So some of the resources to look at how rumor and legend create stereotypes and that kind of stuff. Yes, I would say there's so many out there. There's so many great folklorists I can tell you the names of. It's a long list, so I can definitely help people with that. But definitely there's the International Society for Contemporary Legend Research. They're amazing. They have a really active Facebook group if you are on Facebook. And they constantly put stuff out, but they're an amazing group of scholars, and they have an awesome conference, and they're very welcoming to people coming to it. And it's a small group. It's like 50 people show up for that conference. So it's really cool because you get to know everybody. But there's a lot of good resources there, and there's so many out there. There's people who've written on disease and all the weird legends about kids wearing sex bracelets, and like there's just so much stuff out there. It's amazing. So it's a really long question that I'll answer later. It's the best answer I have for right now. Okay. Okay. Any other questions?
I am a former sexual health educator.
Oh.
So one thing that I've noticed through this is that in places like here where folks aren't as interested in engaging with how things are spread, we have seen some increased concerns and educational bridges built because of COVID and the way that COVID spreads. And you mentioned earlier about the mRNA vaccine and how exciting that will be when we're at this stage. I was just wondering if there are other new strategies that we're using in public health because of this process that for someone who's been doing the work past this time, you're excited about sort of seeing.
Oh, okay, yeah. So basically, things that I'm seeing that I'm excited about in public health that I think that so many things I have seen, and some of the things I've seen have been really small little things that I'm like, oh, that was brilliant. There was, I believe it was the Ozarks Health actually came up with a plan where they called it something like Get Vaccinated in Secret. Because they realized that there was so much social pressure to not get vaccinated in that community. So they basically put out something on Twitter that was like, hey, we'll make sure that no one knows you're getting vaccinated. Come set up this appointment. We'll basically backdoor you in this way somehow and get you vaccinated, but no one will know. And apparently the next day, their appointment's completely filled. So I thought, oh my gosh, that was so easy. It was one tweet and all of their appointments filled. So there's little things like that we can do. We have to know our community in order to do these things though. Another really brilliant thing that I am still blown away by, I was talking to a nurse who had someone had come in for their COVID vaccine. She was administering the COVID vaccine, and he was kind of expressing fears about the magnetic part of it. And she just, I think she was just like at the end of her day, and she was just like done. And she just turned to him and was like, "Do you see this bottle?" And he's like, "Yeah." And she says, "See right here, it says do not shake." And he's like, "Yeah." And she's like, "Well, there's a bunch of doses in here." He's like, "So how would I get the magnets to distribute evenly if I can't shake it?" And he went, "I don't know." First part of doubt, right? All you had to do is introduce that one little thing. And if you come to my talk tomorrow, I will tell you all about this kind of stuff. But it's all about like pulling at those little strings. But I was like, oh my gosh, that was brilliant. That was such, and it didn't demean him in any way. She just pointed out like, hey, here's something I know that makes me know that this is not true. So like, let me share that with you as an individual. So I was thinking like, wow, why don't we have that? Like, why don't we talk about that more? But we get so focused on these big health campaigns that we don't think about the little stuff. So yeah, that's some of the little stuff that I got very excited about. Another thing I got really excited about too is one of the things that folklorists like to do is we like to form community partnerships. We like to work with communities, and that's hard, especially when you're an academic, because I don't have any time. And I want to keep up my relationships with people, so I discovered the world's easiest way to do this. I found in my town that one of the big areas that a lot of people gather, especially in ethnic communities, is restaurants, especially ethnic restaurants. And I was like, wait a minute, this is a perfect way. These are leaders in the community, because a lot of them are well-known people in the community. They're trusted in the community. And all I have to do to maintain my relationship is go eat delicious food. Done, right? I was like, oh my gosh, why did I not think of this earlier? Like, this is the perfect way to keep up this community partnership, is like, I need to partner with more restaurants or more people that run through restaurants and are part of the community, and have that be my end, because now I've just discovered the world's easiest way to keep up my community partnership is to go pick up takeout or just go there once a week. And they keep seeing me, they know me, I'm a known quantity. People come up and ask me questions now that I'm a known quantity and they know what I do. And it has made it so much easier, and I get delicious food out. Sometimes I even get free delicious food out of it. So it's like, it's a win-win-win situation all over. So little things like that, I think that's what we really need to focus on, because I think we focus way too much on the big stuff, and the big stuff works for some people, but it doesn't work for everybody. And that's what we're dealing with. We hear so much about people who are refusing vaccines, but they're still in the minority, right? Even though we hear about them all the time, they're still the smallest group of people. And if we want to convince that small group of people, we have to work with that small group of people, not with big campaigns that are like just blasting the same information over and over again. So yeah, that's the stuff I'm excited about, is people like doing the smaller stuff. Yeah.
Based on that, do you know of any, again, like resources or people put together sort of reporting?
Okay, so I was asked if there's like a group of resources on that stuff. Yes and no. So I think that there's been a new trend in the past few years of creating what are sometimes just called syllabi, or like group project kind of stuff, where a lot of people are putting information into like a Google Doc and putting it out there. You have to know where to find those though, and that's kind of the hard part. But there was like a lot of like COVID-19 syllabi, there was Black Lives Matter syllabi, there's all these kind of things. That's been the best place that I've found so far where people are putting out that information. But then you got to find them, and that's sometimes the hard part, is that people are creating them, but then they're hard to find unless you like follow them all on Twitter or something like that. And then you're constantly on social media. And that's a huge time suck, as we all know. So it's a time suck I love, but it is a time suck. Okay. Any other questions? No? Okay. Well, thank you so much. Yeah.
Help me welcome and thank. And I did want to bring back up like one of the things that she just mentioned, that there is a follow-up workshop tomorrow at 11:30. It's down in the large group room down on the first floor. If you didn't register, it's also just fine. You can come. We've still got some space left, so we would love to come talk more, a little bit more intimately about some of the strategies and things, if that's what you're interested. 11:30 a.m. The other thing I wanted to mention, and it's a little bit self-promoting, but I'm totally going to do it. The Oklahoma Oral History Research Program here actually in the last few months has gotten an Institute for Museum and Library Science grant award to conduct interviews with people about their experience with COVID in Oklahoma. And so we are starting that project where we're talking to people about like what it's been like to live and sort of all the adjustments and like issues with long COVID and things like that. So that's why I love you brought that up, because I was like, oh yes. And we would love to hear if you have thoughts on who we should be talking to. And so in the Facebook chat for the live feed for this, I put a link to a Google form that if you have thoughts, I'm also going to update our the OHRP homepage on the OSU library. So it's like the library and then go to the oral history section to find that. Or you can just email us at liboh at okstate.edu and we can send that to you as well. So I don't know everybody in the world, right? Like, or everybody in Oklahoma, but I bet you all have thoughts on people that you know have had different experiences throughout the last couple of years. And we'd love to hear from you about that. So again, this is really timely work. I'm so glad that you were able to come and visit with us. I know that I saw a lot of note taking. I know there's been a lot of thoughtful discussion in different classes a lot too about how we source information. So again, thank you so much for your time, Dr. Sheeta.